This is Dave with ToothyGrinStore.com. Today's topic is restoring preventive dental care for poor could save public money, not to mention individuals. I found this article on the News Tribune website, and you can find a link to it there. It's a great article, however, it's rather lengthy, so I thought I'd break it down to some simple, basic facts. They figured out that Medicaid cuts are allowing people only one alternative, and that's an emergency room visit or an office visit that will only result in a pulled tooth. So the expense becomes quite high for the system. But pulled teeth are quite expensive, and so are their replacements. I guess these government entities, have realized that prevention is the most cost-effective rather than having to wait until a tooth needs to be pulled. It's a cheaper procedure to do a little prevention work. It preserves people's teeth better, thank you. This is the problem today. Prevention does pay. It pays for the government, obviously, they just figured that out, to support it, but it also pays the individual, no matter what socioeconomic class you might be in. You see, lost teeth are expensive, and no matter how you look at it, they're expensive. You've got to pull them and have them replaced, either with an implant or a denture. Something has to be placed in that spot. You can't leave a hole in your mouth because the rest of the teeth will shift around, causing even more problems. So you've got to do something, and so those are very costly expenses. Loss of another tooth means modification to a denture or a new implant. And gum disease is the big reason that people lose their teeth. It is the number one reason, whether people know it or not, and apparently they don't know it. You can ask any dentist out there, any dental professional, and they will tell you that gum disease is the biggest cause of tooth loss. Many dentists will even go as far to say that about 75% of people have gum disease. So that's 3 out of every 4. That means the odds that you don't have it are only 25%. The problem is nobody knows they have it until it's time for an expensive treatment, because generally they're not told until it reaches that point. So that's part of the problem. But we've concluded, or the government, or whoever's running that Medicaid program, has concluded that preventive dental care is actually cheaper than waiting until it's time to get a tooth pulled and replaced, because those bring big problems and expensive problems in and of themselves. There's a link, right? My favorite preventive tool, and there will be a link to this entire page underneath this video if you happen to be on YouTube. And with it, maybe you'll have better odds. Maybe it will help you to prevent the rampant spread of gum disease and tooth loss. This is Dave with ToothyGrinStore.com. Again, there's a link to this page under the video. Thanks for watching.